Welcome to surgery at MidState.
The green light laser is a technique that's used to help men with large prostates who are having trouble voiding.
As men age, their prostate grows. It's the only organ in the body that grows as you age. And eventually, if it grows, it's like a donut growing around the urethra, but it's not growing on the outside of the donut, it's growing in the region of the hole of the donut, making the hole narrower and narrower, and more narrow, so that it's harder for urine to go through it. And by eliminating that extra tissue, you reopen the hole.
The green light laser actually vaporizes the extra prostate tissue.
The green light laser beam seals the blood vessels at the same time that it vaporizes, meaning it opens up the channel completely and relieves the obstruction that the prostate is causing.
It's a relief for somebody who's been waking up 4 times a night and dribbling urination and things like that. So it's a definite improvement in quality of life.
Patients can be done in an outpatient setting. The more traditional surgery that was available required 2 or 3 days in the hospital post-operatively.
It's the same level of care for this condition as they could get anywhere else. The advantage here is it's a small hospital, so it's very personal care.
We're doing robotic radical prostatectomies, which is the operation done for men with prostate cancer.
The radical prostatectomy, the standard procedure for the previous 18 years of my experience, was a small incision below the belly button down to the pubis and then remove the prostate through that incision.
The open technique was fraught with some amount of possible complications, namely blood loss. In the post-operative period, there's issues with erectile function, there's issues with continence, not to mention pain after surgery.
It's become a minimally invasive procedure in terms of taking care of a very serious problem and what used to be a very serious operation.
There's an advantage in that we have magnified the area that we're looking at and doing surgery so it can be performed more precisely than it was previously.
The nerves that allow for erections run right alongside the prostate. So with this better visualization and these more precise instruments, I can make sure to leave the nerves behind that will allow a man to regain more normal function after surgery than I ever could.
The advantages is a little bit less pain, possibly a shorter hospital stay, improved continence early on.
Less pain, less stay in the hospital, quicker back to work, less need for pain medication.
Those are all advantages that we see with the robot.
It's added an alternative for patients so that they can stay closer to home and still obtain the very best in the technology that's available.
Certainly patients that were more fearful of going through surgery now are more comfortable with the option of surgery as a treatment for their prostate cancer.
When a patient has a new diagnosis of prostate cancer, we have 2 ways that we typically administer radiation, either with external beam radiation therapy or with seed implants.
This is a minimally invasive procedure. It's done in the operating room.
When you're doing a seed implant, what you're really doing is you're putting 15 or 20 long skinny needles in a very narrow space.
We place radioactive seeds directly into the prostate that will ablate or kill that cancer tissue.
You use the hollow center of the needles to guide the seeds. The urologist gets the patient in the right position and does the imaging, and then I put all the needles and seeds in. When all the seeds are in the right position, we remove the needles.
For the right candidate, the seed treatment, what we call brachytherapy, is very effective.
The patients spend an hour or 2 in the recovery room, and then they're home that night. By the next day, most people are up and around and active and doing yard work and shopping.
We've had excellent long-term results with that. A good minimally invasive procedure.
It really is amazing.
I think one of the nice things about urology is that we work well as a team and try to get the best treatment for the patients that we take care of.
They're being offered the same surgery with an excellent staff, an excellent support team, well-trained surgeons, and the best technology available.
The one thing I can tell you that MidState has to offer compared to other hospitals is the way in which they treat the patient. The patient's the center of care here.